Good afternoon and welcome. My name is Tim Poe. I'm Director of Telehealth with the UNC Cancer Network. It's January 8th, 2020, our first lecture of the new year. Happy New Year. Thank you so much for being with us here today for our patient-centered care lecture. And what else can I, this was previously the RN and Allied Health series, now patient-centered care. We've done our sound checks. Hopefully you're hearing us, seeing us, everything is working. If you're running into any problems, technical issues, please call us 919-445-1000 or email us unccn@unc.edu. So glad to have you here this year. Let's see, what else can I tell you? You can always find out a ton of information about us on our website, unccn.org. We will be using Poll Everywhere, as we always do. So there are multiple ways that you can join us via Poll Everywhere. Very simple way is to go to pollev.com, enter UNCCN, and then you'll dynamically see the screen change as different questions come up. You can answer those. And then at the very end, you can go ahead and submit your own questions for our presenter. You can also join by text. You'll text the letters UNCCN to the number 22333. You'll get a message back that says that you've joined, and then you can respond with the appropriate letters that correspond to the answers to the questions, and then text in your own questions at the end. Last thing you could do is you could download the free app from Poll Everywhere and use that, and that works very well also. Okay, we always have new lectures coming up. We've got a whole new series for 2020. We've got live lectures. We've got our self-paced online courses, which you can take anytime, day or night. And then there are no, we also went through our library and our YouTube channel. You can view our lectures, although there are no credits available in that way. Let's see. Our Poll Everywhere question, don't respond yet, but this is what it is exercise has little impact on cancer treatment. If you believe that, you're going to go ahead and put in true. If you think, no, maybe it does have some impact or maybe a lot of impact, go ahead and mark that false. This should be kind of a softball. All right, and without further ado, I want to introduce Gabrielle Brennan. Welcome.
Hi, nice
Thanks
to meet you.
Good to meet you. Thank you so much for being here today. We're really pleased to have you and excited about the topic that you'll be speaking to. Let's see what we know about you already. You just recently joined UNC's cardiac rehab team as a clinical exercise psychologist after previously working as an exercise specialist at UNC Meadowmont Wellness Center as the director of LiveFit Cancer Exercise Program. Is that right so far?
Yes, I'm a clinical exercise physiologist with the cardiac rehab team.
Great. Okay. And you're a 2018 graduate of St. Francis University in Pennsylvania with a Master of Science degree in cancer care.
Yeah.
Great. And additionally, you have a Bachelor of Science degree in exercise physiology from St. Francis University and a Bachelor of Science degree in veterinary and biomedical sciences from Pennsylvania State University.
Yes.
Wow, so very well qualified. And college is an American College of Sports Medicine certified exercise physiologist and cancer exercise trainer. Mm-hmm. Wow, and publication holds a publication in the Journal of Physiology and Sedentary Behavior. And what is that publication about?
So that publication we actually did on healthy college-aged people at our campus. So we looked at their sedentary time and looked at what exercise did to impact the different physiological traits.
Great.
Yeah.
And experience includes establishing a student professional operating rural cancer exercise clinic for patients at St. Francis, and worked alongside leading researchers in the field such as Karen Mustian, and at the University of Rochester Strong Memorial Hospital on multiple local and national cancer-based research studies. What's something we should know about you that we didn't cover there?
Oh, geez. I I guess a fun fact about me would be I'm an avid runner, so I like to run a lot. I did cross country throughout my undergraduate college, so one of the reasons I came down to the warm weather down here was so that I can get to run more often and not have to freeze my butt off.
Good, good for you. And we've had great winter weather for that.
Yes, yes.
Well, thank you so much. Let's jump into our poll everywhere poll. So far, I am seeing a trend here. So again, exercise has little impact on cancer treatment. We've got a small percentage of folks saying that's true, and a much larger percentage of our audience saying no, that's false. What would you say to them?
So our larger bar is probably going to be the one that's looking to be more correct. So
okay.
Yes.
Okay, and that's all what we're going to learn all about in this talk, the benefits of exercise for cancer patients, with Gabrielle Brennan and MS, ACSM EP-C and CET. So I'll pass the controls over to you.
Thank you so much.
Okay, and am I right that our audience needs to get up and move a little bit today? Is that right?
Yes, we will be doing a lot of moving. So
okay, I'm just going to
store.
Good. So just going to give you some warning ahead of time. So if you're elbow to elbow with colleagues for this activity, make sure that you're going to have a little bit of room to move around.
Yes, that's a good disclaimer. So thank you again to the UNC Cancer Network for having me to do this first lecture of 2020 with the benefits of exercise for cancer patients. This is a brief introduction to the huge field that is still developing on exercise oncology. So I'm just going to kind of touch on some of the basic information that is out there, and then if you are so inclined, you're welcome to kind of explore more on your own and dig in deeper. So I hope you all enjoy. So our objectives for the day that we're going to be looking at, we're going to be exploring the LiveFit program that was offered at the UNC Meadowmont Wellness Center, as well as other cancer exercise programming throughout the area. We're going to describe the American College of Sports Medicine guidelines for exercise in cancer patients, and we are going to discuss the effect of exercise on cancer patients. So my first question to you, which you don't have to, everybody can answer amongst themselves, would be, who is an exercise physiologist? So some people may be able to answer that really easily, others not so easily, but the answer is not me. So you can't say that I am an exercise physiologist, because yes, while I am, I'm more concerned about what exercise physiologists kind of know. So we're going to kind of move on through to the next slide, and we're going to find out just about that. So exercise physiologists start out schooling with an exercise science or kinesiology background. They'll get their Bachelor of Science there, and then once you've achieved your Bachelor of Science degree, you move on to two kind of branches. So you can take a clinical route, or you can take a health and fitness route for certification purposes. So if you choose to take that health and fitness route, you will maybe become a personal trainer, maybe do something with group exercise and become a group exercise instructor. You may also become just a certified exercise physiologist. Now, these three types of training, the American College of Sports Medicine, as well as a few other nationally recognized areas, are going to provide these certifications for people that have bachelor's degrees. In the clinical side of things, there's also a certification that you can get through the American College of Sports Medicine that is talking about a clinical exercise physiologist. And somebody that's a clinical exercise physiologist is required to have a little bit more background, a little bit more knowledge about the field, because we are working clinically. So we are going to have typically a Master of Science in exercise physiology, or if you do have a bachelor's degree, you're going to need at least 1,200 hours of some type of clinical experience with patients. So that is kind of a summary of where you can go. We also have, if you'd like to further pursue, you really like doing exercise and studying about exercise, you can go on to a PhD or a postdoc and contribute to some of the research that our ever-growing field definitely needs. So to elaborate a little bit more on my degree, I actually was one of the first people that was part of the Master of Cancer Care class in Pennsylvania, as was mentioned previously, who received that Master of Science in Cancer Care degree, and it was pretty awesome because we got to work and learn hands-on some information on exercise and how that impacts cancer patients. And with that, I'm trying to think because I just lost my train of thought. With the cancer background that we were able to achieve, it's kind of similar to somebody that would be a physical therapist that would kind of go through their residency program to further, like in sports medicine or another specialty, or a doctor that would kind of further to go in a residency to further on their degree. So the program that I was able to achieve at St. Francis was a program that was a master's program where I did an additional 2 years and specifically was focused in oncology patients training with exercise. So to move on, we're going to kind of look at what those 3 letters, a cancer exercise trainer behind my name, actually means. So you have to pass the CAT exam to get these letters, and this exam was made up through the American College of Sports Medicine and American Cancer Society, and in order to pass this exam, there are some topics that I'm going to kind of just scroll on and list here. Anything from exercise prescription programming through knowing basic exercise physiology, related exercise science, knowing the physiology, diagnosis, and treatment, human behavior counseling, nutrition and weight management. So these are just some of the things that a cancer exercise trainer has a background on and can help your patients out with. So we can work with anyone along a primary care team, so that would be an oncologist or a regular doctor, nurses, physical therapists, occupational therapists, anybody that's kind of part of that cancer survivorship network. So we are now going to move on to what is exercise oncology. So a lot of people are familiar with the term oncology, and they might just think, okay, we just put exercise in front of that. What is that? So exercise oncology, the field was actually named in this article that was cited in the Annals of Behavioral Medicine in 2005 by Dr. Carrie Cornea and colleagues that talked in this article about the study of exercise barriers in colorectal cancer survivors who participated in a randomized controlled trial. So they are pretty much the people who have paved the way to kind of create this term, exercise oncology, and be able to kind of have a common term that we're all kind of contributing our research to and expanding this research field in. So to move forward, I tried searching through different research articles and different textbooks to try to actually find what the definition of exercise oncology actually is. So to my knowledge, I could not find an actual definition. I apologize if I had missed it, but I have developed my own kind of coined, kind of rolling definition here, that exercise oncology to me is a subspecialty that's within a multidisciplinary cancer care team. And this is concerned with understanding the effects of exercise as a primary form of prevention and a complementary form of treatment. And this is throughout the cancer survivor continuum. So this would be pre-diagnosis the whole way through the cancer survivorship stage. So while we're working on defining terms, I also wanted to define my term exercise snack. So we, as we have kind of referred to at the beginning of this presentation, are going to be doing some exercise snacking today. So it's the healthy kind of snacks that we can have starting off the new year, where you will all be happy that you can stick with your New Year's resolutions. So this exercise snack term was actually featured in the New York Times, and it originated from a group of researchers that were in Canada. They talked about, in this article here, brief intense stair climbing that improved cardiorespiratory fitness. And it showed that sedentary women who completed these 3 20-second bouts of stair climbing and performed one session with several minutes of rest in between actually increased their fitness by about 12% after 6 weeks. So Allison and company kind of decided, okay, we're going to look at this a little bit further. So then Jenkins went ahead and did another research study where they looked at stair climbing exercise snacks that improve cardiorespiratory fitness. And with this study, this time they looked at 24 healthy and active college students, and they initially tested them, and by the end of 6 weeks, the exercisers had increased their aerobic fitness by about 5%. So they also showed improvements in leg power, and they also showed improvements in power while cycling. So all this to say that as little as 20 seconds of exercise done several times a day may be enough to improve people's fitness levels. So even if you don't have cancer, this is something that we can all do. I think we all can spare 20 minutes or 20 seconds a day to do something small, just get moving and do some exercise. So of course, because we can spare 20 seconds, we're going to be doing a few different bouts of 20 seconds of exercise throughout the talk today. So if I now haven't scared everybody away by now by mentioning that we're going to do exercise, we're going to go a little bit more toward the dark side of things, and we're going to kind of look at the age-adjusted death rates for the 10 leading causes of death in the United States. And this is information that is based on the most recent CDC numbers that have been pulled from the 2016 and 2017 data. On the left-hand side, you can see that these are going to be the causes of mortality and the diseases that people may have. Across the bottom, we're going to see our deaths per 100,000 in the U.S. standard population. So we have the dark blue bar is going to be the 2016 numbers, and the light blue bar is going to be the 2017 numbers. So as we can see here, we've got heart disease, cancer, and unintentional injuries are going to be our top 3 leading causes of death within the United States. So if we were to kind of look at cancer here as the second leading cause, I also kind of want to point out that there are some comorbidities of patients that have cancer. So oftentimes people who have cancer might not just have the specific cancer that they're diagnosed with. So they may have heart disease, which is the #1 leading cause of mortality. They may have some type of a respiratory disease also going on. They may have diabetes. So all of these things kind of are contributing to cancer. So I just like to pose the question that, you know, if we combined all of these leading causes of mortality and combine them with cancer, we may actually have cancer as the unofficial leading cause of death in the United States. So moving on, we're going to kind of look at the next slide here, which is a bunch of squiggly lines and numbers. So I know it's a busy picture here to look at. The top numbers across the top are just some ICD codes. Across the side, we've got our rate per 100,000 of U.S. standard population. And across the bottom, we've got our timeline. So this is our years from 1958 the whole way up to 2017 when this data was made available. So this data comes from the National Center for Health Statistics, and the different lines are representative of the different diseases that we saw on the previous slide. The numbers that are in the circles are going to be corresponding to the ranks of where they were in deaths. So I just would like to point out the top box, which is what I was really going to focus on here. And if we can see kind of that green line, the top green line of diseases of the heart, we can see over time has actually taken a decrease. And almost looks like it's about ready to be overtaken by the malignant neoplasms that are underneath there. So I just wanted to point this out, as well as CNN actually had an article that just came out couple months ago now, that talked about middle-aged adults in a high-income based cities, and ages 37 to 70, there was a article published in the Journal of the Lancet, and they referred to that deaths from cancer were now more common than those from cardiovascular disease in these high-income and middle-income countries. And these countries included Sweden, Canada, Chile, Argentina, Poland, and Turkey. So I thought this was kind of an interesting thing because we are seeing, the numbers kind of start to change, and it's going to be interesting because in the study, the researchers noted that this epidemiological transition might be due to improved prevention and treatment of the cardiovascular disease, and whereas strategies to prevent and treat cancers other than tobacco control kind of are having large reductions where we don't necessarily have all of the resources yet. So another kind of interesting thing that has been out there in the news recently about exercise and cancer. So moving on, I just kind of wanted to pound home the fact one more time that our estimated new cancer cases are going to be in the top here, and our estimated deaths are going to be in the bottom. So looking at males on the left versus females on the right with our numbers, so a lot of people that are going to be diagnosed who are male are primarily going to be diagnosed with prostate cancer, followed by lung and bronchus, or colon and rectum. In females, commonly they're going to be diagnosed with breast cancer, followed again by lung and bronchus, or colon and rectum. Moving on to the estimated deaths, so an interesting thing to look at here is the top reason that people are passing away is not actually due to prostate or breast, which is the number one cases that are diagnosed and estimated new cases. Lung and bronchus is actually in both males and females going to be the number one thing that people are passing away from. Then following closely second in males, we have prostate and then colon and rectum. And followed closely second in females, we have breast cancer and then colon and rectum. And these numbers were from the American Cancer Society in the Journal of Clinical Cancer. So what are our odds of developing cancer in the United States? So we know that there's the new cancer cases, so we can actually do some math. So take the new cancer cases, divide it by the total population, and then let's multiply by 100 to get a percentage. So we can see if we do the math. I'll let everybody calculate for a second. Do all those crazy numbers. I'm just kidding. We've got that right there. So 53% is going to be the numbers that we get if we crunch all those numbers and do the percentage. So what that means is that if I'm here and you're there, between me and you, one of us is going to have some type of encounter with cancer throughout our lifetime. So this is really important, and it kind of drives home that point that it's even more important that cancer is being diagnosed more and becoming more of a common thing. So we all are going to be impacted by it eventually in some way. So we're going to come up to the first poll everywhere question.
Alrighty. And so that is, what type of cancer has the highest mortality rate in both men and women? And if you think that's breast cancer, you're going to select that option or select A. Prostate cancer, select that option, or B if you're texting. Lung and bronchus, C, and colon and rectum, D. And I've heard a couple of reports that a few folks were having trouble accessing Poll Everywhere, but I also know a lot of folks are, so I don't know if this is a regional outage or if something else is up. If it's not working for you via the web, you could try the app or the texting function. But hopefully, I see that we do have a lot of answers coming in. Hopefully you're able to submit your answer. So again, breast, prostate, lung and bronchus, or colon and rectum, which type of cancer has the highest mortality rate in both men and women? How did they do?
Well, I must have been a good teacher. You have all did great. So yes, that is the correct answer. So lung and bronchus is going to be the correct answer. There has the highest mortality rate in both men and women.
Great.
That is correct.
And thank you to our audience for sharing your answers.
All right, so it's time. We all warned you. It was going to be time to get up and do some exercise. So you have sat long enough now and listened to me babble on. So it's time to get active. So I want everybody to go ahead and get up out of their seats. And as you can see, our first exercise is going to be a wall push-up. So I'm going to go back here so that everyone can see how to do this. And we're going to do about 20 seconds of some exercise. So I'll start the countdown, and I think this should work. Actually, would you like to start the countdown and then just
sure.
so that if
Absolutely.
you hit this arrow, it will kind of start the
Right.
countdown?
Okay.
So I'm going to go right over to the wall. So I'm going to have everybody take about a couple steps away from a wall. Make sure that your wall, if you're in an office space, that it doesn't move. So we want a solid wall. We want to put our hands about a little further than shoulder width apart, and we're going to go ahead and do a wall push-up. So feet again are out from the wall, and we're going to go ahead and control our bodies down toward the wall, and then extend our arms and control them back up.
Oh, and you ready?
Yes,
Go
you
ahead.
can
All
count
right,
inside
there we
the
go.
counter. So we're going to get our exercise time in. So we're going to go ahead down toward the wall, and then control back up, extending our elbows forward. So down toward the wall and controlling back up. And you can go as fast or as slow as you would like. This is all up to you. And we are about halfway through. And I will give you a hint that my timer is a little slow, so we might be doing a little bit more than 20 seconds of exercise. But that's okay. So we've got 5 more seconds left. So easing our way into the wall and controlling back up, trying to keep a straight back as we do it. Don't let that lower back dip in. And great job. So we're down to 1. So go ahead and, if you were seated before, go ahead and find your seats. We are going to get back here to the lecture. If you have some water, which I know all of you have water by your desks, grab a drink, and we'll go ahead and come back to the lecture here and talk a little bit more about the next topic, which is where can I exercise? And you all might have the answer to this already. So, this is my little slide of Dr. Seuss because he actually knows where you can exercise, just like we did. So you can exercise here, like I just did. You can exercise there, where you just did, or pretty much anywhere. So that's the great thing about exercise is that you can exercise pretty much anywhere as long as you bring yourself. So that is my little punchline there. All right, so we're going to talk a little bit more now about the LiveFit Cancer Exercise Program that is offered at UNC Meadowmont Wellness Center. I was previously the director of this program, so I'd like to kind of talk more about the exercise programming that we offered there. So the program is designed to help any type of cancer survivor ease their way back into physical activity, and this is with the help of trained fitness professionals. This was a 10-week individualized group exercise program, and it was held at the UNC Meadowmont Wellness Center. It's limited to 6 to 12 participants, and the cost is $100 for members of the gym and $120 for non-members of the gym. The exercise classes this past time were held Tuesday and Thursday evenings, and we did meet for about an hour and a half both of those times that we met. So moving on, during the exercise program, this included progressive exercise. So we worked with anything from cardio machines, we did some strength training, we did functional training, core training, flexibility, and range of motion training. There were some aqua aerobics classes that were included, some yoga classes, some low impact aerobics, and then we also had mindfulness and meditation training, as well as nutritional counseling. And both of these things were actually administered by a professional. So we had a professional come in and do some meditation training, as well as a nutritionist who did nutritional counseling with our patients. So prior to participation in the LiveFit Cancer Exercise Program, we ask that there's a completed application which includes doctor's consent, a review of medical history, and the health-related questionnaires. So we do not have access to medical records as part of this program, and it's important that we do get a doctor's consent due to if there's any type of range of motion issues with their patient, or any type of things that we need to be concerned about, to be mindful of while we are exercising with them for safety concerns. So another thing that we also would like to have prior to your participation in our program is some functional exercise testing. So this includes body composition, vital signs, a 6-minute walk test, and a 1RM strength test. And this testing is done again after the 10-week program it takes place, so that you can kind of see where you have fallen as far as progress. So now I'd like to talk a little bit about a few friends and colleagues that I have been able to make while I've been in the area. So one of my good friends and colleagues, Dr. Claudio Battolini, is at the UNC campus, and he helps to run the Get Real and Heal program there. This program has provided post-treatment support for women with breast cancer diagnoses since 2006. It's designed to help cancer survivors regain their strength, cardiovascular fitness, flexibility, balance, coping, and hopefulness. And this is a 16-week individualized group exercise program that's held at the Outdoor Education Center on the UNC campus. And they meet about 3 times a week from what I understand. Their cost is that it's free of charge, and this is offset by donations. And the only eligibility requirements that are for their program is that you be diagnosed with cancer, and that you complete your cancer treatment within the past year. So if you'd like more information about this program or how to be involved, the contact person for that program is Carly Bailey. She works for the UNC Lineberger Comprehensive Cancer Center, and she's the Physical Activity and Wellness Coordinator. Another program that I believe that she is also involved with is the Health Score program, and this is a program that is a health coaching program offered by the CCSP. And the goal is to help patients and survivors to thrive by working with them where they live, to focus on their function, access to resources, and their overall wellness. So this is a home-based program, and it includes personal health coaching on physical, emotional, nutritional, and other supportive care. So that's another little tidbit that you may be able to do if you don't like to go out. That's a home-based option that you would have. So another program that you may find throughout our area is the YMCA Livestrong program. So this is designed to get cancer survivors back on their feet. It's a 12-week exercise program held throughout the area at local YMCAs. So the link provided here should get you to the webpage to find out if your YMCA has this program. Typically, in the past, this has been offered on Monday and Wednesdays from 4 to 5:30 in the evening. The cost for this, for survivors and family, they receive a free membership to the YMCA due to their annual campaign. So the contact person for this program would be Louise Kiefer, and she's a health coach out at the YMCA in Carrboro and Chapel Hill, as well as Chatham. So that would be the contact information there. And then lastly, the last program that I've actually been able to experience some of is with the Ullman Cancer Foundation. So they do what's called a Cancer to 5K, and they provide a community of support for cancer patients. And this primarily, the Ullman Foundation is based on youth and adolescent cancers. However, regardless of your age, treatment status, or physical ability, the survivor participants get to run or walk alongside coaches and volunteer Sherpas with the ultimate goal of completing a 5K race at the end. So a fun fact about this is that they actually include the cancer survivors race registration right in with their free training program. So this is a 12-week program. This in the past, this was offered in Raleigh. And like I said, I've had a great opportunity to get to kind of volunteer and see the great community of people that come out for this. It's ran by coaches Jack Bowling and Zach Turner. There have been talks that it might come to Chapel Hill, so be on the lookout for that. But the best place to find out where this information would be is the Cancer to 5K at allmanfoundation.org. The practices for this were typically held 2 times a week, and they had one practice in the morning and then one practice in the evening, 2 different days throughout the week. So that is the Allman Cancer to 5K, and we're ready. I know you've heard me talk a while, so we're going to do some more exercise. So the next thing we're going to do is some sit-to stands or some chair squats. So I'm going to have everybody go ahead and stand up. I know you already did one, but we're going to do another one. So everybody go ahead and stand up. And if you have a rolly chair, make sure that you are aware that your chair is rolly. So I don't want you to fall off your chair, because that might be some live entertainment for your office mates. So if you have a rolly chair, just be mindful of that. If you have a regular chair, then that's okay. You can feel safe that you hopefully will be okay with that. So for a sit to stand or a chair squat, it's exactly what it is. So if we started out sitting, we're going to just go ahead and stand up. Okay? And that's all a sit to stand is. So we're going to take our feet about shoulder width apart, and I'm going to have, can you just hit that little timer?
Absolutely.
And we're going to go ahead and do approximately 20 seconds of sit-to-stand chair squats, or chair squats, whichever term that you would prefer. So with our feet about shoulder width apart, we're going to lead with our butt down toward the chair, and we're going to come back up to standing. So just go ahead and tap your butt on the chair and come back up. So we're not going to go fully to sitting. We're going to come down toward the chair, come back up. And we're doing some squats. We're getting some lower body and leg exercises in. And we're already halfway through. Just keep on going. You're all doing such a great job. Thank you for being good sports. And we're almost done. We've got 3 more seconds. And 2. And last one, make it your best one. Coming up for standing. Very nice job. Very good. You can all go back to your comfortable seats. So if you need a drink again, I encourage, if you like water, go ahead and grab a drink. And we are going to move on with the next question that you're all probably asking me now of, why should I exercise? You just killed me there. So we're going to talk a little bit more about why should I exercise. So the American College of Sports Medicine has a few exercise recommendations that they like to just recommend for the general healthy population of people. So our exercise recommendations are aerobic training for about 150 minutes per week of moderate intensity activity, or 75 minutes per week of vigorous activity, or you can do a combination of both of these things as long as you're getting somewhere between those minutes per week. And an easy calculation there, if 150 minutes a week is too hard, 30 minutes for about 5 days a week. So if you do 30 minutes of exercise at least five days a week, then you're set for your aerobic training. As far as your resistance training, they recommend that you do at least 2 to 3 days per week using all major muscle groups of your body, and also some flexibility, so doing some stretching about at least 2 to 3 days a week, and we want to get about 10 to 30 seconds of stretching in as well to maintain our flexibility. So moving on, then I'm going to talk a little bit about exercise and cancer prevention. So this lovely schematic here that you can all see was developed by Katie Schmitz, Dr. Katie Schmitz and colleagues. This was actually just released back in October. They had a meeting, their second meeting of the roundtable for the American College of Sports Medicine that focused on cancer and exercise, and they have graciously allowed us to be able to share this with you all. So if we focus on the center circle, we can see that for all adults, exercise is important for cancer prevention and specifically lowers the risk of 7 common types of cancer. So this includes breast cancer, endometrial cancer, kidney cancer, bladder cancer, esophageal cancer, stomach cancer, and colon cancer. So this is something that has been researched, and everybody has kind of came together and they've made this statement that for all adults, exercise is important for cancer prevention and treatment. Moving a little bit further on, we're looking at the American College of Sports Medicine exercise recommendations for cancer patients. So this is looking at aerobic training. So our overall goal when we are doing aerobic training is to progress gradually to that 150 minutes per week of moderate intensity exercise. So we are not expecting you to go from 0 to hero, right? So we don't want you to go from sitting on the couch and not doing anything to all of a sudden, you've taken on 150 minutes per week. So, we want to try to maybe increase the frequency that we're doing it though. So 3 to 5 times per week. The intensities are listed below at moderate or vigorous. And our duration is at least 150 minutes per week of moderate intensity, or at least 75 minutes per week of vigorous intensity, or that equivalent combination. And then we want to progress slowly, so 30 seconds to 2 minutes longer per day. So not necessarily, again, not pedal to the metal, we're gradually getting ourselves to work into this. And what type of exercise can we do that would be considered aerobic training? So prolonged rhythmic activities that are using large muscle groups. That would include walking or cycling, swimming. You could use an elliptical trainer, anything that is using large muscle groups and rhythmic motions. And then other goals that we're going to look at while trying to increase our overall aerobic training is going to be to increase our peak VO2, our total work, and our endurance. So some special considerations that are cited here that is that the intensity may need to be adjusted during treatment, as well as the exercise. You might not be able to do exercise every single day to start. So and for long periods of time to start. So it's fine to start out and divide it into 2 to 3 sessions a day and maybe just do 5 minutes and then take a break and then do 5 minutes more. So that is all okay starting out exercise training, and the reasoning for this is, that's a good reason to refer to exercise physiologists, as they kind of know the backgrounds and the art of being able to prescribe exercise properly to cancer patients as they are going through their journey. Then we have resistance training recommendations. So these are, again, going to be a frequency of 2 to 3 times per week with an intensity that's beginning with less than 30% of their 1 RM or 1 repetition max and progressing in small amounts. Their duration is going to be at least 1 set for 8 to 12 repetitions for each muscle group, and they will gradually increase in progression, so increasing in resistance following 2 consecutive symptom-free sessions. So what can we do with resistance training? What type of exercise is resistance training? We can use free weights, resistance machines, weight-bearing or functional tasks, and those are just to name a few. So our goals are to increase our muscle strength and endurance, and special considerations for this is patients with metastatic bone disease and hormonal treatments are to avoid excessive weight-bearing activities. So then continuing on to flexibility, we would like frequency to be at least 2 to 3 days per week. We want it daily, and before and after exercising is going to be when the most effective time is to do our flexibility exercises. Our intensity, we just want to move through the range of motion as tolerated with all muscle groups. And this, again, stretching and all exercise is going to be varied based upon what someone's cancer diagnosis is. Because somebody may have had, a breast cancer, so they might have had surgery, so they may be more limited in a shoulder range of motion, or, chest stretching may be painful for them. So everything is kind of specified to each cancer patient. The duration for our flexibility exercises would be 10 to 30 seconds per stretch. And when it says statically there, I like to recommend that people typically will do dynamic stretching before they exercise, and then do the static stretching where we would hold the stretches after the exercise. So that's usually a little bit more effective way than injuring our muscles before we kind of start exercising by holding stretches. And then we progress as tolerated. We can do stretching such as yoga. Our goals are to increase our flexibility and range of motion. And then again, as I already alluded to this, so following approval from your surgeon or doctor, we need to look, at special considerations for shoulder mobility stretches, specifically in breast cancer survivors.
All right. So in the guidelines for cancer patients, the American College of Sports Medicine recommends to progress gradually to 150 minutes per week of moderate intensity aerobic training. So true or false, audience? And if you feel that's true, an A, or just mark it true, false. If you're texting, you can put in a B. All right, we'll wait a few more seconds, give folks an opportunity to respond to that. I think they're on to something again here.
They are. They're doing very well. The answer is true. So for all of those of you that put true, you are correct. Very nice job.
All right.
All right, so
now I hear we get to meet some penguins. Is that right?
We do. We have the March of the Penguins just in time for January. So we're going to be doing some what I call seated penguins. I won't make anyone get up out of their seats this time for our exercise snack. So I'm going to go ahead and start the timer. You can actually probably do it just in your seat. I think that the camera should pick me up pretty good from this. So let's go ahead and we're going to have our palms facing outward, and we're just going to sit kind of like a penguin would sit. And I'm going to count the timer, and we're going to go ahead and we're going to take that pinky down toward the side of our chair, keeping our head and neck and spine all in line, and we're going to sit back up, and then we're going to go down toward the other side, and we're going to sit back up. So, and this can be varied based on your, how comfortable you feel with doing this. So you can go slow or fast, but we're going to go ahead and go side to side like we're little waddling penguins. This is going to work on your abdominal strength and core muscles. So if you think about your belly button and kind of engaging that belly button as you go through the range of motion, that is what we are aiming for. So I'm very, very, very proud of everybody. Thank you for doing that. We all have successfully did some seated penguins today. We've all actually successfully did a whole minute of exercise because we did 20, 40, 60 with our exercise snacks today. So great job on that. Again, if you need a drink of water, you're more than welcome to grab a drink. And we're going to continue to move on here and wrap up the lecture. So how is exercise beneficial for cancer patients? So this will be close to the last topic I'm going to cover today. So as I mentioned before, so Katie Schmitz and her colleagues have met at the second roundtable with the American College of Sports Medicine, and they are pretty awesome because their lead researchers in this field have came together, they worked really hard, and they put this wonderful table that they have given us together that talks about the effects of exercise on health-related outcomes in those with cancer. So this table will broadly kind of go over, I'm not going to read each and every line down for you, but this broadly goes over that there's all of these things. There are strong evidence that has been cited in research studies with cancer patients that the first column there is looking at aerobic only. So if patients were to do just aerobic exercise for that amount of time, that it strongly influenced and benefited those outcomes that are on the far left side. If they did resistance only, again, the outcomes there and the amount of time that they did these sets and reps and the number of times per week they did them was strongly associated with having the outcomes and an improvement on the outcomes on the left-hand side, as well as looking at the very last column. If we look at the combination of aerobic and resistance exercise, and for those specific recommendations that are listed there, that's something that we have seen kind of a strong evidence that is shown to improve these cancer-related outcomes. So cancer-related outcomes that have been seen to be improved is cancer-related fatigue, our health-related quality of life, physical function, anxiety and depression have been, decreased or improved, and as well as lymphedema. So one little belief that a lot of people have is that they can't do strength training if they have lymphedema because it's going to exacerbate that, and that is false. There's been a strong amount of research to prove that strength training does not influence lymphedema. And then furthermore, this is just another excerpt from it. So this is looking at some moderate evidence that we have. Again, you can see there is some spaces where there is insufficient evidence right now. This is a new and growing field. We are researching more and more every day. But we can show that for bone health, that resistance training was shown to improve bone health, as well as aerobic training was actually shown to improve sleep in cancer patients. So these are some good things to note as well. So to talk a little bit more about outcomes with the LiveFit Cancer Exercise Program, this existed since 2012. So this is actually before I was at the Wellness Center. So it was ran by Dustin Butters and a few others. And they served about 60 patients, and the average age of the patients served was about 58 years old. And the average number of sessions that were attended by most cancer patients was about 12, and this is in the traditional 10-week period that we have. So you can see from the pie chart on your right-hand side, we have our gender enrollment. So we largely were female-based, but we did have a strong portion of men as well. So that would be our distribution of males versus females that were in the program. So for the LiveFit Cancer Exercise Program, types of cancers that we have seen strongly has been breast. However, our second most experienced type of cancer that we've seen has been colorectal. That is the second cause. And I think the slide may have cut off. The prostate cancer is missing on this, so that's just a disclaimer. And that should be your bright green. That is right to the left of the teal half there. So that would be the numbers for prostate cancer. Moving on to the time point of treatment. So we have seen anywheres from someone starting out, they've just way before they've been diagnosed, they've been diagnosed with cancer, but they have not did surgeries or anything else. So that would be like their pre-treatment, anywhere through post-treatment. So people that have been through their treatments and now they want to get back on their feet and get moving. So the majority of patients that we have saw has been post-treatment, but we have seen people during treatment and pre-treatment. So this is a kind of busy slide, but I wanted to give people some information. So this is the outcomes of the LiveFit Cancer Exercise Program. And on the left-hand side, we're looking at the different outcomes, as I stated. And on the bottom, we're looking at the number of people that were tested. And the orange is looking, or the yellow is looking at people that did not improve. And the teal is looking at the people who maintained or improved through this exercise program. So as we can see, different things of improvement. There was increased flexibility, increased strength. We had the majority of people walked further. We had BMI improvements. We had decreases in waist circumference. We had their blood pressure was lower. But as they were exiting the program, they improved on their balance and they improved on fatigue. So all of these things are, cancer-related side effects that were for sure improved through the LiveFit Cancer Exercise Program.
All right. So our last poll everywhere question, and then you'll have an opportunity to ask questions of Gabrielle in just a minute here. So which of the following health-related outcomes in those with cancer has strong evidence leading to the benefit of exercise? A, physical function, B, bone health, or C, sleep? And I'll go ahead and show the responses that we already have. We're definitely trending in a certain direction here.
Yes.
And we'll give you about 10 more seconds to go ahead and put in your choice. all anonymous. All right. Gabrielle, how are they doing?
They're doing excellent. Very nice job. Yeah, so the cancer-related outcome that has the strongest evidence is physical function here. Bone health and sleep actually had moderate evidence, so everything still does have a benefit. But as far as research purposes, we are still researching to provide that strong evidence. So bone health and sleep were both moderate evidence.
Great. All right. I'll go ahead and close this poll out and open up the one for questions. So while Gabrielle is finishing, you feel free to go ahead and start submitting your questions.
Yep. And I just have one concluding slide yet. So after hearing all this information, you might be wondering, well, what can I do or how can I help? So what you can do is you can assess. So you can assess if all of your patients are physically active. This is something that can be done in either a doctor's visit, or if you're a physical therapist, you might be able to assess that in a visit with your patients. You might be able to, if you're just from the public and just sitting here, ask yourself, am I physically active? And then how you can advise patients to safely increase their physical activity. And you can do that through referring patients to cancer exercise trainers or appropriate exercise programming that would be based on their current activity levels, medical status, and or preferences. So thank you so much for this presentation, and thank you for joining me. And we now have room for questions if anyone has any questions.
Great. So we do have a few minutes for questions. We hope you'll submit yours. Although in the meantime, I'll start to ask some of my own. So once upon a time, I think it was kind of conventional wisdom that if somebody had cancer, was being treated for cancer, the idea was to take it easy. Maybe somebody knitted you a nice shawl and you could sit and just not be active. Obviously, the research you're discussing today shows us something very different in terms of improving outcomes. Are those old views still out there, and if so, how do we overcome those, whether those are in patients or healthcare practitioners?
Yeah, so that is very true. So it was, in the olden days, a lot of doctors would recommend that their patients kind of remain sedentary. It was, the disease wasn't that well researched. We've had a lot more research that has been put into cancer now. So we don't want you to remain not active. No rest for the wicked, as they say. We want you to get out there and get moving, even if it's just, a couple of minutes to just get up and go for a walk and then sit back down. We are all very understanding that this is not an easy process to go through, or, people may not be going through this process very easily. So that's fine, but we just want to kind of give you that little extra nudge to kind of get out there and get active, because it has been strongly shown now through research that exercising is going to benefit versus doing nothing. There's a lot of, with the cancer drugs, there have been some cardiotoxicities that are associated with cancer drugs, and it's actually been shown that exercising while going through these treatments with the cancer drugs has actually been shown to decrease the cardiotoxic effects of these drugs on the heart. So I can't say to exercise enough.
Great. I know you had a chart that was very interesting, and just wanted to make sure, of course, you can download the slides and see the link to that there, but that was bit.ly, bit.ly/cancer_exercise_guidelines. So if anyone wanted to find that chart, there's a shortcut to that there. We do have it here. I'm glad to see we've got some responses. Or some questions rather. Here's our first one. It seems these programs are accessible only in bigger cities like Chapel Hill. How do you foresee reaching patients who are in rural areas? Great question.
Okay, great question. Yeah, so I do know through St. Francis University, where I went to school, that we were working through the university. and we started to develop a cancer and exercise program that was for rural cancer patients at St. Francis. So our closest cancer hospital was Pittsburgh, and for any of you that aren't familiar with Pennsylvania, it was about almost an hour and a half to 2 hours away for cancer patients to make that drive. So reaching cancer patients in rural areas, I know that there's been some research that they're starting to do some home-based exercise programs, which is really unique and pretty cool. If somebody wanted to just exercise and be able to have somebody to guide them there. So something like a health coach or a little tablet that somebody may get, that they would be able to have that personalized one-on-one training with a cancer exercise trainer to kind of guide them along their exercise programming.
Great. And we'll be on the lookout for other resources. You know, I can only imagine that in the same way you can now take jazz guitar lessons from anywhere in the world, that there's going to be more access to online programs, with the notion that that we won't be able to reach all rural areas in person, but that hopefully there'll be more online resources available. We have a few more questions. Could you reiterate the home exercise program offered through LiveFit?
So as far as that, there is not a home exercise program that is offered through LiveFit. I'm not sure what the people that ran it previous to me did, but what I did for the people that I ran it, they actually got to take home the exercises that they were doing with us at the clinic, and then they were checked in with, afterward, with their consent, they were checked in with to see how they were progressing as they transitioned out of that program.
Great. We've got 4 more. We'll try to get to those quickly. Who refers into the exercise program? One of the MDs or nurse navigator at the cancer center, patients themselves? Good question.
Yeah, so for the LiveFit program specifically, I can't speak to any of the other programs, but for the LiveFit Cancer Exercise Program, it's been actually a combination. So I have had nurse navigators who have contacted me, and they've referred their patients, as well as patients will just come in themselves into the wellness center and see that this program is offered, and they will want to sign up for it.
Great. Let's see. Gabby, how can someone who wants to start studying in this field find a program that suits them?
Good question. So I always recommend shadowing. So shadowing in the field and kind of trying to find what best suits you and what your real passions are. So like if you're in physical therapy, they're working on range of motion and they're working on fixing a specified problem. Or if you're doing, if you're a doctor, you're working on, the whole diagnosis treatment pattern. So finding something that you really are truly in love with, and then if you want to, if this field is something that you really like, then kind of reach out. I know our program at St. Francis University, we're one of the first Master of Cancer Care programs, so I could get you that information if you'd like to do that, as well as there are now 2 and almost a 3rd class of graduates. So I have a few friends who are also now working in the field. So they're kind of spread out throughout a couple of different areas. So I could get you in contact with them to be able to shadow somebody specifically in the cancer exercise field, as well as if you're interested in research. Research is a great thing to do. So looking at schools with maybe different programs, if you're interested in pursuing a PhD or doing a postdoc, there are people that are looking at more specific to just exercise. So maybe, how something's affecting, how does exercise affect this small little thing in cancer, or your metabolism or something like that. So just kind of do some research online, get some information on the good programs that are out there with cancer.
Great. And very briefly, any suggestions for exercise in patients that received cardiotoxic chemo in the past?
Good question. So for that, all I can say is, if you're not exercising now it's not too late. So if you're worried about, my heart already has this cardiotoxic treatment and I'm doomed, you're not, because any type of exercise, if you are sedentary, right now, any type of exercise that you can do is going to benefit you in so many ways. Great. So don't be worried about that. You're doomed.
Great. And last question, and then we'll go ahead and wrap up. In terms of dosage, is there a minimum amount of exercise duration that should be performed to see clinically significant gains for patients with and it cuts off there, but I'm assuming a cancer?
Yes. So the exercise recommendations that I went over today are the minimum amount of exercise as far as like durations, like when we talked about like less than or equal to the 150 minutes. That is the guidelines that have been put out there by the American College of Sports Medicine. It's typically up to the exercise physiologist that is working with the cancer patients to determine that progression. So how far, we can push them until we feel like, we're going to kind of determine that duration. So we leave that kind of up to the exercise physiologist to determine each exercise duration based on each individual cancer patient and their diagnosis.
Great. All right. Well, we're at a thank you point. I do want to ask our resident expert on doing the processing for after the lectures is actually in the air right now, flying out to San Francisco to attend a continuing education conference. That's Dr. John Powell. So if there's a little bit of delay in terms of getting your email, we apologize for that, but we'll make sure to get that to you today. Thank you to the North Carolina General Assembly for their generous support of the University Cancer Research Fund and the UNC Lineberger Comprehensive Cancer Center. Thank you to our team, Mary King, Veneranda Obore, and John Powell. Gabby, thank you. It's been really a pleasure to have you here. This has been great. Just briefly to mention, of course, we always have more lectures coming up. Prostate cancer management in North Carolina updates in 2020 with Dr. Wang is on January 22nd at noon, and the role of patient support networks in cancer outcomes with Dr. Justin Yap, that's coming up February 12th. We've got self-paced online courses, always more there. Here are a couple of them just briefly so that you can see what's coming online. Cancer Conversations, this is a not-for-credit program that's coming up as well. If you have any questions, reach out to us, unccn@unc.edu. Thank you again. Until next time, we look forward to seeing you later this